Ecosonoids. Synthesis and inhibitors. All are reversible NSAIDs except aspirin. NSAIDs inhibits COX enzyme, COX-1 and 2. So starting, COX is cyclooxygenase and LOX is lipooxygenase. So arachidonic acid is acted upon by COX-1 and 2, irreversible action by aspirin, and then it creates prostaglandin and thromboxane A2. Prostaglandin mediates pain, pyrexia, inflammation, and thromboxane A2 mediates platelet aggregation. NSAIDs inhibits cyclooxygenase. On the other hand, lipooxygenase is inhibited by xylitol. Lipooxygenase creates leukotrienes like C4 and D4, bronchoconstrictors, and montelukast and zephyrlocast also inhibit leukotrienes directly. Prostaglandin analogs. Prostaglandin E1, common use, maintain patency of ductus arteriosus. Note, drugs used in erectile dysfunction. Drug of choice is sildenafil. Other drugs used are phentolamine, bremelanotide, naltrexone, ketanserin, alprostadil, trazodone, alviptadil. Drugs of prostaglandin E1 is misoprostol, which is used in NSAID-induced gastric ulcer, abortion, postpartum hemorrhage, least effective. Second is alprostadil, which is used in erectile dysfunction. Prostaglandin E2 dinoprostone is used in postpartum hemorrhage, cervical ripening, drug of choice. Prostaglandin I2 is used in pulmonary hypertension due to it as it causes vasodilatation. Drugs are epiprostenol, recommended PGI2. PGI2 analogs are iloprost, beraprost, treprostinil, selexipag, PGI2 receptor agonist. Note, other drugs used in pulmonary hypertension are endothelin antagonists like bosentan and abrasentan. Prostaglandin F2 alpha drugs are carboprost, which is used in postpartum hemorrhage and abortion, and latanoprost and bimatoprost eye drops, drug of choice in open angle glaucoma, normal tension glaucoma. Side effect is heterochromia iridis, dry and sandy eyes, macular edema, hypertrichosis, used in treatment of hypertrichosis, and contraindication is uveitis. NSAIDs, non-selective COX inhibitor. It inhibits both COX-1 and COX-2. Acetaminophen, paracetamol. Mechanism of action. It inhibits COX-1 and COX-2. Decrease prostaglandin synthesis, and hence gives analgesia, antipyrexia, anti-inflammatory, poor effects. And it promotes TRPV1 receptors and cannabinoid receptors. Hepatotoxicity, most common cause of drug-induced liver failure. NSAIDs. Mechanisms: NAPQI paracetamol metabolite depletes glutathione, free radical scavenger, free radical damage to liver on histopathological examination, centrilobular necrosis, and periportal sparing. Note, most common cause of drug poisoning, paracetamol. Symptoms: there are symptoms of renal tubular necrosis, hypoglycemic coma, and hepatotoxicity. Dose 150 to 250 mg per kg or more than 10 gram. Fatal is 20 gram. Prediction of hepatotoxicity. Remark Matthew nomogram. Here you have plasma concentration, you have time, safe zone, and unsafe zone is above the line. Management: less than 4 hours of consumption. Charcoal. Drug of choice is N-acetylcysteine. No response. Fulminant hepatic failure. Emergency liver transplant. Aspirin. Dose dependent effect. 50 to 325 milligram oral dose. Used as an anti-aggregant. 325 to 620 milligram SOS. Max 4 doses per day, used as an analgesic and antipyretic. 3 to 4 gram per day, divided doses, anti-inflammatory. Uses of aspirin: anti-aggregant, rheumatoid arthritis, rheumatic arthritis, niacin-induced flushing. Drug of choice is aspirin. Essential thrombocytopenia, Kawasaki disease, also decreases the risk of colon cancer. Side effect of aspirin: most common is bleeding, Reye syndrome, viral fever in children, aspirin, hepatic encephalopathy, salicylism toxicity, dose more than 10 gram, clinical features: seizures, tinnitus, hyperglycemia, metabolic acidosis. Treatment of toxicity: symptomatic dialysis, severe toxicity. Contraindication: viral fever in children, gout, inhibits uric acid excretion with warfarin, increased risk of bleeding. Indomethacin mechanism of action: inhibits COX enzyme, inhibits phospholipase A and C, inhibits leukocyte proliferation and migration. Uses of indomethacin: acute gout. Drug of choice: Bartter syndrome, paroxysmal hemicrania. Side effect: frontal headache. Side effect of indomethacin is frontal headache. See. Paroxysmal hemicrania. It is a headache, a really bad headache on one side of your head or face that don't last long but happen several times a day. Then it is called a rare type of headache called paroxysmal hemicrania. So drug of choice is indomethacin. Sulindac. Indomethacin derivative, similar uses: blocks FAP, familial adenomatous polyposis, decreased risk of colon carcinoma, decreased risk of breast and prostate cancer. Ibuprofen. Uses: analgesic and anti-inflammatory. Patent ductus arteriosus, drug of choice for closure in India. Side effect: most common drug inducing aseptic meningitis. Toxic amblyopia and blurred vision. Note: patent ductus arteriosus worldwide, drug of choice is indomethacin. In India, it is ibuprofen. Drugs related to ibuprofen: ketoprofen, mechanism of action: inhibits COX, inhibits LOX, and stabilizes lysosome, and inhibits bradykinin. Flurbiprofen, eye drops, prevents intraoperative meiosis. Piroxicam, enterohepatic circulation, longest acting. Slow onset of action, analgesic in chronic pain. Ketorolac, increased potency and uses: ketorolac, acute pain, oral parenteral, migraine intranasal spray, ocular plane inflammation, then eye drops. Diclofenac, it has short T half, long acting due to concentration in joints. Side effect hepatotoxic, GI ulcers, decrease by formation with misoprostol. Naproxen enantiomer, nebumeton, naproxen derivative, non-acidic, long-acting. Uses of diclofenac: rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, gout, dysmenorrhea, acute pain. Selective COX-2 inhibitors, classification oral and parenteral. Oral are celecoxib and enterocoxib. Parenteral are pericoxib, which is used in acute pain, post-operative pericoxib. Oral celecoxib and enterocoxib is used first for anti-inflammatory and second for pain, third line drugs. And anti-inflammatory is rheumatoid arthritis, rheumatic arthritis, psoriatic arthritis, ankylosing spondylitis, and gout. Third line drugs in pain are dysmenorrhea and acute pain. Side effect: most common hypersensitivity rash, nephrotoxicity, renal papillary necrosis, cardiotoxicity, rafecoxib and valdecoxib. Peptic ulcer, non-selective, more than selective COX-2 inhibitor. Drug of choice, proton pump inhibitors. Drug interactions: decrease effect of antihypertensive drugs, decrease lithium clearance toxicity, decreased effect of diuretics like furosemide. Continue with gout in the next video.